Here I'm facilities lead for the One Partnership NHS Trust. So I'm managing a team of around 90 people, and I am as well a coach for the NHS, and I'm a feedback facilitator for the NHS as well. So this is my role inside of the NHS.
And how do you use clean language?
So clean language, one of the things that strike me in clean language is these things of not doing presuppositions about people. So basically, when I'm managing people, there is a lot of issues that they arise between my team, like people conflicts between people, and it's very easy to jump into conclusions. So one of the things that I try to do is asking questions that give me a lot of information about the context of a specific behavior, for example, and that's very important because in that way I can understand which is the cause of the behavior, and how can I try to avoid a behavior or support the staff in that way. Also, one of the questions that we have been discussing as well that is very useful is what would you like to happen? And I question this a lot to my management team, and because I have in my team 6 team leaders who are the managers of the rest of the team. So when there is an issue that arises, I ask these questions and I ask myself this question. So for example, we have had an audit of the environmental agency in which it was quite good, but it could have been better. And I was a little bit frustrated. And then is when this question arises, all right, what would you like to happen next? And then is when I direct my thinking of processing what I'm going to do next to improve this audit in the future. So this is the way that I'm using mostly to understand the context in the behaviors of part of the members of my team, and try to direct the thinking in something that it goes from conflict or a problem to more an outcome or a goal. Does it make sense?
It does. So when you are asking yourself, what would you like to happen? What difference does that make?
So it moved me from a blaming position on a grumpy position, like, oh, that has not been perfect, that has not been good, we should have been done this shouldn't have happened. It goes from this inner dialogue and this state to a moral, all right, so what I'm going to be doing next? I'm going to do this step, I'm going to do this step, I'm going to speak with these people, we are going to come all together, we are going to go with. So it moved myself from this state of conflict, let's say, to more an state of problem solving, of going for an outcome. And
So
that's
problem
very
solving
important. Yes, problem solving. Yeah.
and going for an outcome. And when you're asking the questions about context and the context that your staff perhaps are in when there's a conflict or a problem, what questions are you asking then?
So one of the questions, so one of the very important thing is the presupposition. So for example, when a person says to me, I was not feeling well, I was feeling bad, I ask them, what do you mean by bad? So I try to understand what is behind the words that the person say to me, because in that way I can understand. Or for example, I'm going from through a difficult situation. What do you mean by a difficult situation? Can you explain to me a little bit more about that? And then they unfold the context, and maybe it's a family difficult situation, maybe it's a personal health situation, and then you start to understand all the things that is behind specific behavior, and that makes me more comprehensive. So basically, where in my first reaction will be blaming the person, why you have not done this, what is going on here, then when I start to ask these kind of questions, like, all right, what has happened? No, I had a lot of problems, a lot of stress. What do you mean by problems? Which is stress? So then they start to unfold this kind of context and make me say, all right, I know. And then I can put something to prevent this to happen again in that way. So if a person, let's say, if a person is having a difficult personal situation, I can give to this person support with mental health that we have in our trust. So I can start to give more support and more. Some people say, I didn't know that I had to do this one. Then I understand, oh, this person has not been trained properly. So then I do the proper training for the person. So these are the kind of questions that I ask. So when they speak to me, is what do you mean by that? Or which I try to go to the specifics of the situation, and by that I try to understand the whole context.
And what difference does that make in terms of saving money, saving time, any of those kinds of things that seem to be so important within the health service at the moment?
Yes. So there is a lot. There is a lot. In what is resources and what is cost of the team, for example, one of the most expensive things that it can happen to your team, people going off sick. It's very expensive. It's very expensive because you have to pay for the person who is off sick, and if you have to cover for anyway, you are paying as well for the person. But usually there is this thing of, oh, maybe I cannot cover, then the rest of the team gets stressed because they have to do the job. So being mindful about trying to avoid people going off sick and try to give the support then to not get stressed. That for me, I'm now doing a lot of research about the stress is very important, and also avoiding the people going off sick, also creating the good environment. One of the things that it comes to my mind, for example, when persons are full of stress, they start to do mistakes and they start to giving up. So let's say part of my team have to have control of the food waste, and they have to minimize the ordering of the food, and they have to try to monitor that the food that it has been delivered is the good quantity, so we don't have too much food waste, because this is a cost and it's also not good for the environment, and it's quite expensive, food waste. So basically, when the people are very stressed, they are very with a lot of anxiety, also they give up, they don't do it, they just don't do it, and then you can see how the numbers start to rise up by giving a supporting network, a supporting environment, and explaining to them why it's so important to be monitoring this stuff. They start to do it, and then you can have a control of this one. Same things with materials. For example, in facilities, there are three parts that we have a lot of influence. One is cleaning and disinfection. Another one is food service, and another one is waste management. So all these things is there is quite of cost involved in there. Cleaning wise is exactly the same. It depends the amount of products that you use, the amount of paper that you use. Paper is very expensive. So if a person, let's say, they put a box of paper in a wet place, or they go with water and they have to dispose all of this, it's a big chunk of money that we are disposing. So by being more careful about the environment of the mental health of the team, they are more careful, they are more disciplined, they are more careful, they take care a lot more for their job and for what they are doing, and then you start to reduce in that way the cost. Mostly, I will say mostly the bigger cost that I think we got and is absence. Absence is huge amount of money.
In terms of facilities, you've got cleaning, food service, and waste management. Is there anything else about those that clean language helps?
Yes. So this is one of the things. Look, in facilities, we have a technical component in facilities: cleaning and disinfection, waste management. There is laws as well. Food, there is the laws of food, but mostly our business is about people. So 90% of the issues that we got in a team of, I say, between 90 and with catering team will be around 100 people. 90% of the issues is people's issues. So basically, if we want to improve our department, we have to focus in our main resources, that is people. And clean language is this kind of things that give you a tool that help you how to know your team and how to develop people. Not everyone, for example, motivates in the same way. So we have to be very individual focused in order to do motivation, or in order to put a position for a person for a trainer, or in order to do professional development. Some people want professional development, some people doesn't want professional development. So going with this kind of clean language gives you the tools to start to know your staff, to know your people. And if a person gets a conflict or a problem, you start to understand what is behind all of this, and helps you a lot to improve the performance of your staff, of your team. By doing that, you improve the performance of the whole facilities. As I say, our business is people business. So we are 95% of our problems, conflicts, investigations is about people. So this is why it's so important. So once I understood that in facilities, catering department, cleaning department, waste management department, that this department goes well when the people work well and go well, all end up in that one. Then if you want to improve the departments, what do you have to improve? The people. Create a good environment, understand which are the motivations, understand when there is a conflict, that we manage a lot of conflicts, a lot of them. When there is a conflict, why is this conflict? Sometimes it's difference of characters. So some people are very proactive, some people are very reactive. If you put them together, it's not a good mixture. So all of this, in order to be able to understand all of this, you have to ask the right questions and not be judgmental. So if a person is reactive, it's not, this person is, no, you cannot judge that person. You have to understand them. You have to be comprehensive of the context, of the situation, of the personality, and then work with that. This is part of the key that it's difficult as well. It's difficult because also I have to do the same with myself, because I have my emotional as well coming in. This is also part of the conflict. So I have to understand as well myself, which is my role, how can I work with that. So this is part of the process. And this is how clean language, I think one of two of the things that for me has been very useful, I have said, is to understand the context of people's behavior. So no do any kind of presupposition. So if a person, let's say, there is person that is more proactive, person is like more reactive. Suddenly, the performance of one of the person who is more passive, for example, start to go down. The easy thought for me is, it's just being lazy. And I go and I punish him for being lazy. You are lazy, you are lazy. You know, and maybe the context, the people start to, they're lazy. But if you ask, maybe this person is going through a difficult family situation, stressful family financial situation. And this stress is affecting his performance. So then you can start to give some kind of support instead of going for the quick thinking of, he's lazy, more to, all right, he's a less passive, he's not so proactive. So what can I do for improving his performance? He's going through a difficult, stressful situation. How can I help to reduce this stress in the person? And also when they see that the team see that you are doing this, not just with the person, but the rest of the team sees that you are doing this kind of approach, they start to be more proactive and more engaging with the team. Our team, that historically facilities it has a very high turnover. We have a turnover that is around 13%, more or less. But all the rest is a very strong team. Why? Because they like the way that we are managing, and they like to stay in there. There is people who have been for this team 50 years. We have Herbert, a person working for facilities. So it's this kind of approach what we are seeing constantly, that is being very useful and is keeping a team together, is an engaging experience, is growing up, and we are performing a lot better. Does it make sense?
It does. And it's exciting. And I'm very curious. One of my curiosities is you're a coach and you know clean language. What is it that clean language is giving you that isn't coming from your coaching? What's the difference?
Very good question. From my personal experience, coaching is about process. It's the process. There is specific questions. There is a goal definition, SMART goals, coaches, which resources do you need? Clean language is very specific in how to ask the questions, which is the specific questions, the specific language that you use. So language is very important. So it's this connection between process, that is coaching, and the language. And how do you ask the questions? It makes an impact in how do you direct the thinking. There is this thing in coaching, no, by like Socratic approach, we ask questions and we don't have an impact in the process of the client. That's not true. When you ask a question, you are having an impact. So depends of which kind of question, the thinking of the person go in one direction or another. To understand that, clean language is very useful, because when you ask a person, what specifically do you mean by that, or things like, what do you like to happen next? You are directing the thinking of the person in one specific direction. And by doing this, in clean language, give you the linguistic precise techniques to be able to direct the thinking of the person in one way or another.
Thank you.
I will say this is the main aspect. Also, in clean language is not all about outcomes. It's not all about goals. This is another thing. There is also the symbolic language that is another universe as well. So there is a lot of things of the quality. Is not just asking questions and going for goal. It's the quality of the questions that we ask what it matters in clean language, I think.
And it sounds as if you don't always feel you have to stick rigidly to the clean language questions. You're not being a Dalek or a machine asking what kind of, or is there anything else about? You're comfortable adjusting them and adapting them to ask a question like, what do you mean by?
Yes. So I think when you see the approach like clean language, at the beginning, you try to use the specific questions because they are like an aid that helps you to understand what is going on. But once you understand what is going on, is a lot in my way of thinking. It's a lot better to incorporate this and try to make it yourself, and it's more natural in your conversation, not to be like a robot. Oh, he has told me that. What is the question? Oh, this question. Throw it. It's more like, I understand what I'm doing with the question. I understand that what I'm doing is, for example, not having any kind of presupposition about what is going on inside of the mind of the person that I have in front of me. And then I ask the questions with the curiosity, and also is the intention and the state of the coach or the manager. When you do it with curiosity and you ask the question with curiosity, to try to understand all the details of what is going on inside of the person that you have in front, what gives you this kind of flexibility and this kind of natural approach of asking questions.
Someone else who does your job might be hearing this and going, I would never have enough time to ask all these questions. You know, there's food to be served, there's wards to be cleaned. How do you ever make time to ask all these questions?
So there is a couple of things. I have incorporated these questions in my day to day. It's not something that I'm going to just have 20 minutes, sit with the person, throw the questions. So, for example, I have undertaken an investigation a couple of months ago about a conflict in my team, and I have to do an interview to one member of my team, one member of the clinical team, and in this interview, I have done this kind of question. I have gone to the details without any kind of presupposition, gone to the details of one person to understand the context from the other side. Also, in my day-to-day, when I speak with one of my staff and they came and they say, this is like this is all a mess. This is all a mess. I say, my first response is, what do you mean by a mess? So I try to understand what it is. So it has become part of my everyday language right now. It's not something that I dedicate a specific moment for clean language. It's part of my everyday language. I do a meeting with my team leaders that I'm doing every month or every quarter. And again, what do you like to happen? So what would you like to do next? Which will be the next steps? Then this kind of questions is what I incorporate in my meetings with them. So the time that you need to invest for learning clean language is the time for the trainings. So you have to go through the trainings. And this is again when we work with in an environment. So I work that 90% of my issues are staff issues. I work with also working with another departments like clinical teams, nurses, doctors. We work with patients. We work in a mental health trust. So a lot of behavior things. The best investment that you can do is try to understand how the people are and how to communicate with them. You know what I mean? It's the best investment. Once you have learned this, your work is a lot easier. Your performance is a lot higher. So, and it becomes your everyday is a tool, is a way of expressing, of communicate, that it becomes your everyday way of communication. And people start to feel that when I have meetings I have had meetings with the director of nurses, for example, because there have been conflicts in the department, and they have understood, because my communication, that my approach is not blaming one, blaming the other. It's trying to understand what is going on here, what is going on, which is the details of the context, and try to start to put solutions to that. And all of this is because the way I communicate with them.
And those kind of situations, like between facilities and the clinical teams, are often very, very tricky.
Yes. So there is this kind of thing. Conflicts. There is conflicts between the members of the teams in one ward. There is conflict between the nurses and facilities. There is conflict between the nurses. So once you have been working in a ward, I have been working as well 2 years as an acute medical unit, and as a housekeeper there, supervisor of the caterers, the cleaners, so together with healthcare assistant, nurses, managers, ward managers, matrons, so infection control, patients. So there is a lot of conflict. Conflict is something that you cannot avoid when you work with people. Because it's part of our nature. One person wants one thing, the other person wants just the opposite thing. So you have to be used to manage this kind of stuff. So it's how you do it and how do you get the confidence is by knowing how the people are and knowing how to communicate with them. Because it's something that you cannot avoid. It's unavoidable. So conflict happens. And when you work with also now that I'm working in manager as a facilities lead, and you work with the managers in the departments, you realize that every decision that I take, it has an impact in my team, it has an impact in the clinical teams. So if I say this is going to happen in the food service, it's not just affecting my team, it's affecting the clinical team, it's affecting the patient, it's affecting everyone. So how we are doing, how we are approaching that is very important, because it's going to generate conflict, and it's going to generate conflict between the managers, between the team members in the world, and this is part of it. This is how we have to work. This is what we generate, and and how we have to deal with that. So in order to be able to be good doing this, you have to learn how to communicate. For me, it's key. If not, you are going to generate a lot more conflict, a lot more stress, a lot more difficult situations that a hospital doesn't need.
Would it be useful if other people learned clean language?
Oh, yes, yes. So from my point of view, it will be useful if everyone learns clean language. Clean language is a tool for communication that I think is very useful. When you learn to listen without judgments and asking quality questions, imagine that healthcare assistant or a nurse has this ability, has this skill, and there is a patient with a mental health. Mental health that also a lot of times comes with a lot of stigma. And then you put this stigma aside and you start to listen and understand and ask quality questions with curiosity to the patient. How this patient is going to feel a lot more understood, a lot more, all right, this person understands me. This is a lot better for them. Do you know what I mean? So the well-being of the patients will improve quite a lot. Not just them, also, this is one of the things, the best facilities assistants that I got in my team are these people who are able to understand the patients, stay with them, interact, communicate with them, because they put the stigma aside. So this is very important. This is very important. The same thing when I have been working in AMU, acute medical unit, and there is a patient who starts to be a little bit aggressive, a little bit upset, and a person sits with them, they start to listen, they start to ask quality questions, they can understand what is going on this patient. Maybe they have been given some health news that are not good news, and there is a lot of an emotional response with that, and they can work with that. So clean language in a healthcare environment, I think everyone should have known these skills, because it will improve not just the team dynamics, not just the quality of the work staff, but also the quality of the patients, the well-being.
Who else has shown interest in clean language in healthcare?
Good question. Yes, I have part of my team leaders that are starting to understand the importance of the communication. My manager understands all my passion or my interest in all of this. He supports me a lot of this. And they are starting to ask questions about all of these kind of tools. So they start to show interest. In the clinical point of view, being honest, I think they don't know yet the clean language and what it has to offer. It's not something that they know. If you speak with them clean language, they don't know exactly what they know about motivational interviewing, that there is trainings of motivational interviewing, or DBS now that is being starting to be quite popular, but not about clean language. When they understand these things is when they start to ask questions. When they go to a training like the one Judy has done and one that is in the energy leadership, is when they start to understand, and they start to be curious about them. In my team, I have to say, in my team, that's I think the good thing. I have 2 managers or 3 who are, let's say, old school, and they are even the old school. They are open to this kind of approaches, and they are still open to learn a little bit of this. Later on, they incorporate to their style. It's not like, oh yes, I'm going to learn clean language and I go full on clean language. They incorporate to way of working, but just this incorporation is very effective. Just if every one of us just learn how to ask questions without any kind of judgment, to understand the context of a situation, and they learn how to ask questions, to move oneself and also the team from a blaming position to a outcome position, just these two questions or these two kind of approaches are very effective.